for joining us. And at the time, you were working on immunization and health system strengthening as a technical officer working with WHO in Monrovia City in Liberia. So this was round one of the polio campaign in 2019 in Liberia, and you were supervising in Monrovia. The team called to say that there's a lady of the Muslim faith who had an issue. Can you tell us what the issue was? And can you tell us what happened and how it turned out? And I'm asking you to unmute. So yes, please go ahead. And a warm welcome to you.
Good afternoon from Monrovia. And my name is Dr. Tiala Korkpor-Mulbah, and I'm very happy to be sharing my story with all of you wonderful people today. As you rightly say, yes, we got a call whilst I was supervising an area in Monrovia during the 2019 campaign. And the issue was a lady of the Muslim faith at home with 3 children under 5. And the team got at her house to do the vaccination, but they couldn't because her husband wasn't at home and she wasn't close with the authority to make the decision of whether the children should take the vaccine or not. So that was it. They called, they got at the house. They couldn't vaccinate the children because the husband wasn't at home and the mother couldn't make the decision of whether the children should take the vaccine or not because that's not her decision to make. So we got there, politely spoke to her. She was a very polite lady. She welcomed us. To note that I got there on the scene along with the national supervisor, who was a male. She welcomed us, but she didn't allow us to enter the house. So basically, we were outside, we spoke. She told us exactly what she told the team members, that yes, she had 3 children under 5 who had previously taken the vaccine, but the fact that her husband wasn't at home, she could not allow the team members to vaccinate the child. So our intervention after getting that information was to request her husband's number, which she gladly did. And we waited for him a little bit to see if he was going to come home. The team revisited the house, but unfortunately he didn't get there that day. So we called him and spoke to him, and he was very receptive. So the next day the team revisited the house and vaccinated the children. So yeah.
Thank you, Dr. Tiala. So your takeaway from this story was, you said one way to address the situation is to recruit immunization teams from all areas or religions. In this case, your belief was that if one of the team members had been from the Muslim faith, persuasion of a mother from the onset would have been easier. Jean Munro, you work on gender in immunization. You had another reflection about potentially another takeaway. And then I also want to warmly welcome Michela Manna from WHO, who's also joined us, and we'll be turning to you, Michela, next. Jean, would love to hear from you on this, having heard this story. What are your thoughts?
Yeah, we've heard this quite a bit, that men have the decision-making power in the home, in certain cultures and certain faiths. And what we've heard from other countries is that they engage men specifically. So they'll hold special men's groups, or the leaders will meet with men outside the mosque and discuss the importance of immunization, and then even bring immunization like a vaccination center to the mosque, and men can bring their own children. So this empowers men to become more active as a parent. It addresses this difference in decision making. But I like what Dr. Tiala did as well. Ultimately, we just really want to get the children vaccinated, and for both parents to be involved in the vaccination.
Thank you. Now, I'd like to turn to Michela. Michela, we of course, many of our listeners know you from the Immunization Agenda, the WHO Scholar course on the topic. We've really appreciated your contributions to Lightning Chats. Now, you had a reflection where you said immunization campaigns need to take into account the different distribution of power in household decision-making and how gender inequality can affect women's agency, ability to decide for their children. Men's involvement in care also needs to be strengthened. If you had been there with Dr. Tiala and she had asked you for advice, what would you have said to her? And if you're able to turn your webcam, that'd be wonderful. But if
hi everyone. It looks like my camera is a bit weird. I don't know. I see myself kind of black and white and twisted. I don't know what is happening with my camera. Sorry. Anyway, it's glad to be here. Thanks, Reda, and hi everyone. No, I mean, I actually had the same reflection that Jean had, and this is really another further demonstration on how we need to involve father. I think what Dr. Tiala did was exactly what I would have done, and it also shows us that, I mean, we don't need to I think to implement complicated solutions. Sometimes it's like the solution is simple. We just have to change the way we implement campaigns and just amplify our the spectrum and involve fathers and as Jean rightly pointed out, empower them and involve them in the decision of vaccinating their children, because this is a demonstration that the father were not opposing to the vaccination of their child. It's just that the mother did not just have the permission, but it looked like it was an easy solution. So that's really a demonstration that we just need